My name is Dr. Robert Newman. I'm director of the Global Malaria Program at WHO in Geneva. And it's an honor to be back at MIM because I really began my career in malaria at MIM. It was the late 1990s and I was living and working in the center of Mozambique, in Chimoio, Mozambique. And I was trying to work with the Ministry of Health to more aggressively scale up malaria control activities in the center of Mozambique. And I'd heard about this conference that was going to take place in Durban. And I convinced my very cash-poor NGO to pay my way to Durban. And I went to Durban and immediately sort of met this incredible group of malaria experts, and some of them were from Centers for Disease Control and Prevention in Atlanta in the United States. And this group convinced me that CDC would be a fantastic place to work. And so as we got ready to leave Mozambique, applied to work at CDC and actually landed in the malaria branch at CDC, where I spent almost the next 10 years before just a few months ago taking up my position as director at WHO. So it really is MIM that is the reason that I'm in malaria control and the reason that I have the job that I have today. So at WHO, our role is really setting normative guidance. So we review evidence and we convene experts to review that evidence with us, and then based on those evidence reviews, we set policy and issue normative guidance that countries can follow. And what I hope to accomplish over the next few years at WHO is to accelerate that process, to review the evidence that's being generated at an unprecedented pace in a timely fashion and in a transparent way, and to make sure that the evidence that's being generated is able to be taken up into policy and practice as quickly as possible. And whether that's for new preventive tools, potentially a review of a vaccine when those data are available, new medicines as they come online, or new combinations of strategies, we are there for countries, for our member states to review that evidence, and then ultimately to provide technical assistance to countries in the scale-up of those plans. For me, what excites me about MIM is that really most of the National Malaria Control Program managers are here too, so it really is bringing together researchers and programmers. And to me, it's all part of the same puzzle, and it's all interesting, whether it's advances in the basic science, in research and discovery of new drugs and vaccines, whether it's operations research on how we better use the tools that we have today, to social research on behavior change and communication. Really, I think the thing that I love about malaria is that it's all interesting to me and that it's all required if we're going to be successful. My first trip to Africa, it was the mid-1990s, and I'd gone to Mozambique after the war, and I was just so struck by what an incredibly important public health problem malaria was. And yet I knew that we had the tools and that there was no excuse for the hundreds of thousands, nearly a million kids a year that were dying in Africa, and that it was tragic and needless, and that we actually could do something about it. And today, even to this day, it's so compelling to me because I know that we can defeat it.